Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Federal government begins third phase of eased lockdown, seeks sustained response to COVID-19 at all levels of government with new guidelines for international travelers and strict compliance with the non-pharmaceutical interventions. Adamawa government fortifies its containment plan against COVID-19 as Federal Medical Center Yola takes delivery of vital equipment to enhance healthcare delivery for women, children and the vulnerable. And New Zealand records her first coronavirus death since May 2020. Now, between August and September, just 4 days into the month, the Nigeria Center for Disease Control, NCDC, says its records show that the number of states with over 1,000 confirmed cases increased from 10 to 12, including the Federal Capital Territory. On case fatality ratio, the Presidential Task Force on COVID-19 says this has consistently remained at 1.9%, indicating improved case management resulting in fewer COVID-19 deaths. Similarly, the cumulative test positivity ratio, which shows how many percent of total tests are positive, has reduced from 15.2% at the end of July to 13.3% at the end of August. However, with only 4 days in September, the number of COVID-19 cases has risen to 54,588 in Nigeria. Last night, 124 new confirmed cases were recorded and 21 deaths in Nigeria. The deaths include 20 in Kaduna State alone, which was recorded in the past month, as reported by the government, according to the NCDC. The 124 new cases are reported from 12 states, and the FCT, Lagos State, has the highest figure from the confirmed daily case at 42. Other states, the FCT 25, Katsina 14, Kaduna 11. We have Kwara recording 8 new cases, Ondo 7, Delta 4, Anambra 3, Oyo 3 again, Edo 2, Ogun 2 as well. Same with Osun State, and 1 case recorded in Cross River State. The NCDC remains optimistic that its efforts are paying off, with 42,627 patients have of course recovered since the virus outbreak in February. Now, at a crucial time, the world is battling a pandemic. The Federal Medical Center Yola has received some medical equipment as an intervention to take care of persons with underlying health challenges. During the commissioning and handover, the donor spoke on how the interventions would aid in saving lives by providing high-quality health care. The equipment comprise general-purpose radiography, the Aero VTC 36000, among others.
The essence of our intervention is to deliver world-class vital medical facilities with the hope that our efforts will make all the difference in saving lives by providing high standard of care not only to vulnerable pregnant women and children, but to other patients seeking urgent interventions with serious diagnostic challenges in the state. We take pride in the realization that military good causes have arrived with the commissioning of these facilities, and the best of good causes in this country are yet to come. I'm here to affirm that our intervention will continue to be pursued in a broad, distinctive, integrative, and inclusive manner across the country.
The sum of 157 million naira has been expended by the Katsina State government for COVID-19 tests in the state. Now, the tests have been conducted from May the 31st, 2020 to date. According to the State Commissioner for Information, Culture and Home Affairs, Mr. Abdul Karim Sirika, he disclosed this at the Government House in Katsina. He said each and every test cost the state government 15,750 naira. He further says tested, 9,601 results were recorded as negative, stressing that only Dandume local government area is yet to return a COVID-19 positive result. He says the biggest challenge is most of the patients that are being admitted will tell you that they are hale and hearty before and because of that, they don't want to stay in isolation centers. He says the number of total personnel that were infected at the health center are 75, with majority of them not exhibiting any symptom.
3 fixed sample collection centers in Katsina local government. We have the maternal and child health clinic at Oferguga. We have Federal Medical Center, Katsina. We have General Amadirimi Special Hospital. In all the other local government rapid response teams, lab personnel, assistant, DNRs, and what have you are present in the local government headquarters and the position to handle likely cases of COVID-19. Case findings through contact tracing is a continuous exercise. All residents of Katsina State that meet up the criteria for testing have their sample collected and tested free of charge. There are reports going on that the state government do charge some amount of money for testing. That is wrong. It does not hold water, it's a lie. So therefore, the testing is free of charge. Confirmed positive cases are admitted and treated for free in our designated isolation centers. It is noteworthy to mention that more than 95% of cases admitted are symptomless.
Now, the federal government has announced the transition to the third phase of eased restrictions with amendments to address economic, socio-political and health concerns. According to the Presidential Task Force on COVID-19, the President approved the following to begin midnight today, strengthening the collaboration between the federal and state organs to harmonize the country's COVID-19 response in the short, medium and long-term basis, an introduction of sanctions, including the suspension of passports or denial of foreign travels for violation of current provisional travel-related quarantine protocols. It talked about modifying the curfew to begin from 12 a.m. midnight today, 4 a.m. Nationwide, which does not apply to people on essential services and international travelers who may be returning from abroad. In terms of communal commercial spaces, it says removing all restrictions. Markets across the country can now open and operate all day. Store owners must take responsibility, abiding with non-pharmaceutical interventions to safeguard the lives of staff and patrons of their facility. Hotels will continue to remain open, but must observe all non-pharmaceutical interventions. Parks, gyms, cinemas can open, but at half capacity and must ensure enough physical distancing to preserve the health of workers. It said that bars and nightclubs are to remain closed. The extension of the 6-month mandate of the Presidential Task Force was also extended till the end of December 2020. In the meantime, Lagos State government says hotels, bars, and nightclubs must adhere to the COVID-19 guidelines despite the relaxation of curfew to 4 hours. Now, the Commissioner for Information and Strategy, Mr. Gbenga Omotosho, says that the Lagos State government has not lifted the restrictions on opening of bars, restaurants, nightclubs, lounges, and cinemas despite the relaxation of the hours by the Presidential Task Force. According to him, all owners of hospitality establishments are warned to restrict their operations to 50% of their occupancy rate, as directed by the governor, in addition to observing the guidelines on physical distancing and the other protocols. Joining us from our Abuja studio is Dr. Philip Nwajiobi Princewell. He's a consultant medical microbiologist, laboratory physician with the National Hospital Abuja, with experience in diagnosing and managing patients for a variety of infectious diseases. Thank you so much for joining us on the program.
Thank you so much for having me here.
All right, I want to start with what we were told in June, the response of the PTF, adjusting the initial nationwide curfew of 8 p.m. to 6 a.m. to 10 p.m. to 4 a.m. in a bid to limit social interactions and essentially reduce the risk of transmission of the virus. Now, they've made a review to begin tonight, 12 midnight to 4 a.m. Do you think that changes anything?
Well, in an ideal situation, it's trying to tell us that we have come a long way, and we think that the number of new cases we are having is gradually coming down, so we can begin to ease things down so that we don't completely shut down our economic activities. But the challenge is that where we were before, we keep having so many people who are breaking these rules, and that's why even as they gradually ease these restrictions, one still has to wonder whether it's really going to do any change, because you still find people who break curfew. And the most important thing, regardless of the curfew, regardless of business hours, is the fact that people have to practice the minimum, which is hand hygiene and physical distancing. That's the most important thing. And that is where we still find compliance rates very, very low. So even though this might help business activities in terms of checking the spread or containing the spread, the most important thing is emphasizing that whatever the business hours, whatever the opening of restaurants, bars, anything we want to do, the most important thing is, even if people are going to be at half capacity, they just have to be able to, do some of these things that we have been emphasizing for a long time.
But some people are questioning the motives of the government, the PTF. I mean, international flight operations are to resume Lagos and Abuja tomorrow, and preparations are to also begin for reopening of schools. But the government says sample collection is low, testing is way below the target.
It's quite true. We are below the target. The United Nations expects that you should have a positivity rate that falls below 10%. If you have a positivity rate, what it means is that if you test 100 people and less than 10 of them are positive, then that means you are testing enough people. If you find that most of the time from the statistics, Nigeria was at 15%, and then we have come down to around 12%, 13, 12%. Some other countries who are doing better, places like Canada, you would see that they're at 1%, because the more you test, the less the number of your positivity rate is lower, but it shows that you're actually, going further into the population to find those who have. When in our own situation, we have a low capacity for testing, and that is combined with the fact that we're only testing people who are actually coming forward that they are symptomatic. It means that the figures we are getting may not be a true reflection of what is happening in the society. We may actually be underestimating the number of cases of COVID we have.
So perhaps is it time now to look at, in terms of research now, maybe some of the homegrown measures? We have the Oniovi Fair, who is saying that if we really look closely, the cure to COVID-19 can be found in our backyard. What's your take on this, especially with regards to immune-boosting herbs against the virus?
I would say this from my professional experience, that if you look at it, the treatment we now advocate for malaria, which is based on artemisinin, is actually from Chinese, from Chinese herbal medicine. That's where the root came out. So it's not that you can't have some of these things coming from our herbology and all that, but you see, we have to move beyond where people just make remarks and nobody puts, the money, as they say, where the mouth is, if I can use that phrase. What I mean is that we need to have a more systemic approach. If he's going to be saying some of these things, then let him tell us what his suggestions are. And I think we actually have research institutes that would be very willing to put their research efforts into this. But for now, most of what we have been hearing is academic. It's quite possible that there's a herb out there that has virulent, virological properties that can actually help us. But it's when we have done research and all that on it. So until we have more concrete evidence, we have to work with what we have. And so far, when it comes to COVID, prevention and containment, so we need to improve our testing capacity. That is very important. We need to expand our testing capacity. We need to begin to, as a people, we don't have to wait for the government to keep singing this mantra and telling us we are moving to stage 1, stage 2, stage 3. Even as an individual, you have to ask yourself, what situation am I going into? what are the possible risks I can have at this stage? So do I have to do physical distancing? What kind of physical distancing can I do? Should I have my own hand sanitizer with me? These are things we should, as individuals, begin to practice. So while we are looking at where we could find the cure, I'm very okay if this could come from not the usual orthodox way, but the thing is we need to know what these things are, have a systemic way, for us to actually approach, a systematic approach, where we can investigate them, so that it's not just something academic that is being discussed.
All right. We appreciate your time. Thank you so much, Dr. Philip Nwajobi Prince-Will, consultant medical microbiologist. Thank you for joining us on the program.
Thank you so much.
We have more on the global response to the pandemic when we return. Please stay with us. Welcome back. Non-compliance with laid-down safety protocols as stipulated by authorities remain a great challenge in the quest to flatten the curve of the coronavirus pandemic. On a visit to the state capital by Channels Television at some parks, markets, it suggests that the face mask, social and physical distancing, among others, are absent by a large number of residents. And to ensure these precautionary measures are adhered to at the grassroots, community leaders, leaders of thought and religious leaders have been challenged to effectively engage residents at the community level. This is also to encourage more voluntary testing.
At the community stage, you have a lot of people who probably do not believe that there is even COVID. If you look at the manner, the way people behave at the community level, it does suggest that these people are aware that something is on. And that's why we need sensitization. Community leaders, leaders of CDAs, ballets, and all those groups that are important in the sensitization at the community level. Opinion leaders at the community level should be involved in the sensitization so that we do not relax and say the thing is over. Because if we let down our guard at this stage, what is happening in some other climes will happen again, where they are now having another kind of implosion, another round of COVID-19 infections, serious ones. So at the community level, what is important that we must continue to obey the protocols.
New Zealand has reported its first death from COVID-19 since the end of May. The Health Ministry says the man in his 50s died in Auckland Hospital on Friday, having been in intensive care for the last few days. Auckland, the country's largest city, has been at the center of a cluster of more than 100 cases of COVID-19 in recent weeks, with 5 more cases reported yesterday.
New Zealand has recorded its first COVID-19 death since May. The Health Ministry says the man in his 50s died in an Auckland hospital on Friday, having been in intensive care for the last few days. It's sad news for the country, which had received international praise for its early response to the pandemic, going more than 100 days without any locally transmitted cases. The World Health Organization says that once a COVID-19 vaccine is approved, Africa will get at least 220 million initial doses. The first batch is expected to go to frontline healthcare workers and vulnerable groups, and the distribution will be based on the population of each country. Meanwhile, the head of the Africa Centers for Disease Control, Dr. John Nkegasong, says all nations should join the WHO initiative to fairly distribute potential vaccines.
So it's in the interest of the whole world for us, as we deal with this generational crisis, to be sure that vaccines are not only accessible to the continent, but accessible in a timely fashion. I mean, the timely fashion is key.
In Europe, COVID-19 has forced 12 schools in mainland France to close, but the rest of the almost 60,000 opened as planned at the start of the academic year. However, Education Minister Jean Michel said on Friday that it has been a rather good week, even though there were some glitches. And South Korea's Peak Medical Association on Friday has called for an end to a doctor's strike, which has complicated efforts to curb a new wave of coronavirus infections after the government backed down on plans to reform the sector. The Health Minister, Park Hong-gu, said the government would halt the proposed reforms and discuss them again with the industry and the parliament once the coronavirus outbreak stabilizes.
Take a look at our website, channelstv.com. You find the latest updates on the pandemic. All you need to do is log on, access the news and health, politics, business, sports, Africa, and around the world, all at your fingertips. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe.